I'm visiting with Dr. Jadine Anderson, who's a chiropractor. Dr. Anderson, people come in for some obvious symptoms like neck pain, mid-back pain, low back pain. What are some more obscure symptoms that a person might come in for?
One of the first things that I'd like to talk about is sometimes people have indigestion problems or even acid reflux that we've been able to help lots of patients with. Not to say that everyone that has these problems will it be fixed by an adjustment, but that's where you can come in. We can do an exam on you. If we find misalignments that lots of times coincide with the symptoms that you're presenting with, I'll be able to let you know whether or not an adjustment will help the symptoms that you are presenting with.
A person suffering from acid reflux could actually need an adjustment?
Yes, and stomach indigestion, sometimes even high blood pressure. An adjustment can be lowered, can lower the high blood pressure. Anything with high blood sugar levels can be changed through adjustments as well. There's a list that goes on. Basically, any symptom that a patient has, there's a possibility that it could be due to a misalignment within your spine, and that's all due to the fact that the nervous system is controlling every organ and every function within your body.
You're saying that someone who has high blood sugar may have a misalignment?
Yes. Where a simple misalignment within their mid-back, you can adjust them and they can, their blood sugar levels will lower or balance out. In fact, I had a lady come in and see me for back pain, and she had checked on her intake form that she had thyroid condition, high thyroid levels, and it had been checking out that way for about 8 months. I asked her when her next evaluation of her thyroid levels would be, and she said in a couple months, because I was finding a misalignment within her spine that coincided with her thyroid gland. And after she had several adjustments and had her thyroid levels checked, her thyroid levels balanced out, and she was very happy about that.
I bet she was.
And with that, she started to have more energy and felt just a lot better.
She had an overactive thyroid?
Yes.
And that was depleting her energy?
Yes.
And an adjustment took care of that? Well, a few adjustments, right?
Mm-hmm.
How about something like achy feet?
Achy feet? Lots of times that is associated with a low back problem, because the nerves that are running down your spine, they come out of your lower back and they run all the way down to your toes, or they run down your hands and into your fingers. Mm-hmm. So anytime you have achy feet, numbness or tingling within your toes or your fingers, it is lots of times associated with a spinal misalignment.
So rather than go to the podiatrist, you might want to go to your chiropractor?
In some cases, yes.
Thank you, Dr. Anderson.